Greetings from Kathmandu, Nepal. This is Dr. Meghnath Dhimal. Today I am going to talk about COVID-19 and health sector response in Nepal. It's my great pleasure to talk about COVID-19 in the GYA International E-Conference 2020, Beyond Boundaries, COVID-19 and Global Health. Today I'll talk about COVID-19 situation in Nepal and unique features of COVID-19 cases in Nepal. Then I'll also talk about the government of Nepal response to COVID-19 and way forward on COVID-19 and health. Situation report of COVID-19 in Nepal. By 23rd June 2020, we have reported 10,099 cases. Out of them, 2,224 are discharge cases and 24 are death cases. We have 77 districts and COVID-19 has already been expanded in 76 districts. So only one district is safe from COVID-19. If you see the epidemiology of the COVID-19 cases, Nepal have unique features. Like among the total cases, male are 90%, female are 10%. If you see the discharge cases, female are 8% and male are 92%. Similarly, in the death cases, out of 224 deaths, 5 are female and 19 are male. That means 20% are female. Similarly, age-wise, 84% cases are reported in 11 to 40 years, in contrast to other countries where most of the cases are reported in elderly populations. More interestingly, only around 2% cases are symptomatic in case of Nepal. This graph shows the daily cases reported in Nepal. First cases was reported in 23 January 2020. Second case on 23 March after 2 months. And now we have around more than 500 cases each day. During this lockdown period of the COVID pandemics, Nepal Health Research Council is continuously working for the approval of the different proposals submitted for ethical approval and for conducting the research itself. So during this pandemic situation, we have already approved 80 research proposals out of the 102 on SARS-CoV-2 coronavirus disease. Some of the key research projects being conducted by the Nepal Health Research Council, where I work, are assessment of emergency preparedness and readiness of COVID-19 designated hospitals and clinics in Nepal, WHO Solidarity Trial, which is the international public health emergency trial. Similarly, use of the convalescent plasma for the treatment of patients with the COVID-19 infection in Nepal. Whole genome sequencing of SARS-CoV-2 and analysis of the immunological parameters in COVID-19 patients in Nepal. And similarly, use of the polyherbal medicines for the management of mild to moderate COVID-19 cases in Nepal is an open label controlled trial. This is the situation of the COVID-19, but other health related indicators are badly affected in Nepal. As some of the direct effect has been seen in the mental health, such as increasing the suicide cases in Nepal, on reproductive health, sexual health, such as increasing maternal mortality rate compared to the last year or before the lockdown. On the children's and adolescent health, like one study from Hong Kong showed that 20% school children had the high stress level. On occupational health, such as stigma to the health professionals. Even in Nepal, some study has shown that health professionals are highly stigmatized, and even some are asked to leave the home by their landlady. So government of Nepal has taken the different response measures for combating the COVID-19. For example, we had only one national public health laboratory which had not capacity to test the COVID-19, but we operationalized to test the RT-PCR of the SARS-CoV-2 from 27 January 2020. We set up the laboratory in more than 21 places across the country, and we developed the different guidelines for the treatment and diagnosis of COVID-19, as well as for the management of other health programs like MNCS programs in the emergency situations. And indeed, government of Nepal focused on the 6T strategy, that is travel restriction, testing, tracing, tracking, treatment, and together. And we operationalized the Health Emergency and Operating Center and started producing a daily situation report from 24 January, and we have already produced 125 reports. We developed and implemented the health sector emergency plan to combat COVID-19 pandemics. And for maintaining the social distance in Nepal started its full lockdown on March 24, 2020, and has been eased from 11 June 2022. But still lockdown is there, but a little bit eased. And only certain hospitals were designated for the COVID-19 diagnosis and treatment to continue non-COVID health problem in other districts. Thank you.